And I think now we're ready to start. So hello everyone, welcome to the Cellpress LabLinks event, Inclusive and Sustainable Diets Within Planetary Boundaries. Today is the second day of this event, and my name is Shanshan Zhang. I'm a scientific editor at One Earth, a flagship journal of sustainability science at Cellpress. Just before we start the session, I'd like to let all our audiences know that you are more than welcome to put your questions via the Q&A tab. And for all our panelists, please do feel free to reply to any questions as you see appropriate. And for those of you who were not here yesterday, my colleague Drs. Swapnika Ramu at MAD moderated two fantastic sessions. So yesterday we have touched upon gaps in nutrition, consumer behavior changes, economic costs, and socioeconomic feasibility in offering inclusive diets in session 1. And we carried on the discussion in session 2 about challenges and opportunities in strengthening food systems resilience locally and globally via sustaining a safe socio-ecological space in a warming world. Today, our program will shed light on the big picture a little more: governance and transformation. And in this forthcoming session 3, we hope to unpack the barriers to and potential measures that can enable good food governance. We will soon start the session with presentations from our 4 esteemed speakers. Professor Barbara Burlingame from Massey University, a nutrition scientist specialized in sustainable diets and food systems and global nutrition policy. Dr. Dariush Mozaffarian from Tufts University, a world-leading cardiologist who builds passion to communicate scientific evidence to policymakers and the public. And Dr. Trevenen-Jones from the Global Alliance for Improved Nutrition, aka the GAN, who leads the Food Systems Governance Program, also design and implement food governance to strengthen food systems and bring healthy diets to all, especially in Africa and Asia. And Professor Hannah Wittman from the University of British Columbia, who investigates food governance through the lens of food sovereignty and community-based approaches. Okay, now let's begin. Barbara, the floor is yours.
Okay, thank you very much. Can you hear me?
Yes.
Let me try and share my screen. Let's see. Having a little bit of trouble sharing my screen. Let's see. Maybe you can start with someone else while I figure out why my screen sharing is not working.
Yeah, definitely. Dariush, would you like to start?
Sure, thank you. So a pleasure to be here. I'm going to see if I can share my screen now. Give me 1 second. Working for me. So hopefully everyone can see my screen here.
Yep.
Yeah, so it's a pleasure to be here. Thank you for inviting me to speak. There's a lot to cover, talking about challenges and opportunities around food systems governance for sustainable and healthy diets. So, I want to start out with, I think, the premise that all of us will agree on, that we face a global nutrition crisis. Poor nutrition, our food system, is the #1 cause of poor health and lack of well-being on the planet. And so this is the issue for health for humans around the world. It's also a major issue for hunger and disparities, for rising healthcare costs around the world from diet-related chronic diseases, which is straining government budgets and straining private business and economic growth. And it's also a major issue for sustainability and climate change, and not just climate change, as we know, but also the majority of the world's fresh water use, the majority of ocean pollution, the majority of tropical deforestation, the stresses to soil and losses of topsoil. And all of this also intersects with national security, as we've seen with the war in Ukraine. And so we really do face a global nutrition crisis. And I think the top issue facing the human race in the 21st century is to fix the food system. Now, this is, highlighted most of all by the global pandemic of diet-related non-communicable diseases. It's remarkable what the world has done in response to the COVID-19 pandemic, and yet many, many more people will have died in the last 10 years and the next 10 years from diet-related non-communicable diseases than from COVID-19, and yet we're not doing hardly anything about this, and it's a little bit shocking. And what this chart shows from the Global Nutrition Report is the proportion of the world's population of adults who are on course or off course to meet NCD indicators for the Sustainable Development Goals, and red is off course. And so you see sodium intake at the top, and then blood pressure, obesity, and diabetes, lots of red. So the majority of the world is off course. NCDs are a global pandemic due to poor nutrition. Now, there have been diets proposed to try to address this, and this is one of the most recognized, the Eat Lancet Planetary Diet, which focuses on eating more plant-based foods and eating less red meat in particular as a solution. And obviously, this is generally a healthy diet, and there are general sustainability benefits of such a diet. But what I want to highlight is that this is a little bit oversimplified as a single solution, that there is a single diet that will create a solution, because the overlap and intersections between a healthy diet and a sustainable diet are actually not as large as one might think. And so first, let's look at what are the health burdens, the global health burdens of poor diet. This is also from the Global Nutrition Report. You see here the numbers of deaths from different dietary factors, and this is looking at the major causes: coronary heart disease, stroke, cancer, and diabetes are the different colors. And there's two bars comparing 2010 and 2018. And you see that most of the disease burden in the world is actually from insufficient intake of healthy foods, low intakes of fruits, low intakes of whole grains, low intakes of vegetables, low intakes of legumes, low intakes of nuts and seeds. Now, high intakes of meats do cause some disease burden, but it's a pretty small part of the overall disease burden. So the key message here is just lowering meat intake will not have a major impact on health. The most important thing we need to do for reducing NCDs is to increase the intake of fruits, whole grains, vegetables, legumes, and nuts and seeds. And it's really not clear to me that that's going to be simple to do in a sustainable way, given the requirements for water use, given spoilage, given cold chain needs, food waste, fertilizer needs. So this is a challenge. And so just reducing red meat alone would have a pretty minor impact on health. And I don't think most people recognize that. We've looked at this in terms of diabetes. This is not yet published. And what's new about this analysis in particular is, for the first time, we've estimated globally the harms of refined grains. Previous analyses haven't had sufficient data on refined grains, but we were able to get data on the harms of refined grains, which in addition to other factors. And we do find that excess intake of processed meats and unprocessed red meats are contributing to a significant proportion of the world's diabetes risk. But at the same time, excess intake of refined grains, sugar-sweetened beverages, and also to a smaller extent potatoes are also contributing to diabetes risk. And so just shifting to plant-based diets won't reduce health risk if we reduce red meats and just increase intake of refined grains and starchy vegetables and sugary products. Now, if we look at the environmental burdens of diet, this is a similar chart with the colors here being the different foods, and looking at greenhouse gas emissions, land use, freshwater use, nitrogen application, and phosphorus application, the latter two being quite relevant for ocean pollution and freshwater pollution. Then, for climate change, reducing and for land use, reducing red meat is a major benefit, as you can see. About a quarter of greenhouse gas emissions due to food are due to beef and lamb, and then about another 15–20% from pork and poultry. So there can be significant benefits from reducing animal products for greenhouse gas emissions and for land use. But for the other global environmental burdens, freshwater use, nitrogen application, phosphorus application, and more, we have a lot of problems from plant-based foods. And so this is my point again, that this is not a simple solution. And so obviously, if we want to improve health, if we talk about a plant-based diet, eating minimally processed plant-based foods is terrific and definitely a priority. But eating refined plant-based foods is a terrible idea. And this is the majority of plant-based foods. And so I really worry about the terminology and focus on plant-based foods. We're really talking about minimally processed plant-based foods, not just plant-based foods, because there's a lot of plant-based foods that are harmful. And of course, these are all also plant-based foods, and ultra-processed plant-based foods are really quite unhealthy. And all animal-based foods are not unhealthy. And so seafood, of course, is quite healthy. Poultry is relatively neutral for health, and even dairy, which for some reason people think dairy is unhealthy, although it's widely recommended by dietary guidelines around the world. Dairy is actually, there's very little evidence it's unhealthy, and in fact, evidence that for at least some outcomes, it's fairly healthy. And so this is looking at relationships of milk, cheese, and yogurt with different outcomes. Generally, there's pretty neutral associations or some slight benefit. Milk is associated with a little bit lower risk of blood pressure and stroke, and yogurt with lower risk of diabetes in particular because of the probiotics. So lowering dairy consumption, won't improve health at all and may worsen health. And so really we have to think about how we lower ultra-processed foods. And I think that's really important as we think about solutions. What is the problem with ultra-processed foods? And hopefully we can get to this in some of the discussion. But I think one of the problem is what is being called acellular nutrition, that we're getting nutrients, in this case, starch and sugar, without any intact cellular structure. And that causes a double hit of too much nutrition into the bloodstream and too little nutrition to our gut bacteria in our microbiome. Now, why this is relevant is because there's also a big focus on protein, and we have to get more protein intake into people around the world. And I don't know why. There's almost no protein deficiency in the world, and there's also almost no evidence that higher protein intake is associated with good health. It's just a very strange focus that we need protein in the world for health. In fact, higher protein intake is consistently linked to higher risk of diabetes. This is a meta-analysis showing that people who eat more protein intake have higher risk of diabetes, not lower risk of diabetes. And one of the reasons this may be, although I don't think we've figured it out completely, is that if you eat too much protein, and in particular acellular protein that's rapidly digested, what happens to it? It gets turned into fat. If you're not building muscle and you eat protein, it just gets turned into fat, just like excess refined starch and sugar get turned into fat. And we have a global epidemic of non-alcoholic fatty liver disease due to excess intake of acellular nutrients. And I think acellular protein is part of the problem. And so when we look at these acellular protein alternatives like plant-based burgers or highly refined insect proteins, I don't know that these are healthy things that we should be putting in the food supply. If you actually eat the crickets, a minimally processed food, that's probably actually quite good for you. But extracting the protein and making it acellular and just putting it into foods, I think is probably bad for health on the planet. And so at the end of the day, we have to think about how are we going to increase the protective foods that are good for our health. And that is a challenge because increasing those foods has environmental harms. And so we have to figure out how to increase those healthy foods and reduce the environmental harms. Animal foods can be eaten in moderation for health. For the environment, it's good to reduce these animal foods, but it's not actually, doesn't make a big difference for health to reduce most of these animal foods. And the worst things in the food supply are, again, plant-based foods, particularly refined grain starches and sugars, also processed meats, highly processed meats, and other ultra-processed foods. And so when we think about governance, what I'm worried about is that I see increasingly sort of tobacco as an analogy. People think, well, we have to tax foods, we have to put warning labels, we have to have marketing restrictions and restrictions on places of sales, but this won't do anything to increase the intake of healthful foods. And so instead, we need coordinated food governance that takes into account healthcare systems, federal government nutrition programs, advancing science and research, using the power of public health and education, spurring business innovation, and also having national coordination. This is really the governance solution, because the challenge is not, again, just getting rid of a few products or lowering sodium or reducing red meat. The challenge is increasing the intake of minimally processed healthful foods, getting consumers to eat them, getting these to be shelf stable, getting these to be shipped around the world, getting these to be lower cost than they are now. That's an incredible challenge, but it's all can be done. This all can be done with a coordinated system where, again, we integrate food and nutrition into healthcare, into federal government programs, better science, better public health, and better business innovation. And I'll just end to say that I'm fairly optimistic because in the United States, President Biden, about a month and a half ago, held a White House conference on hunger, nutrition, and health to create a national strategy to end hunger, improve nutrition, and reduce diet-related chronic diseases by 2030. This is a very ambitious strategy. I encourage all of you to read it, which really does take a whole of government approach to improving nutrition, including integrating food into healthcare, including using procurement and the power of public health and regulation, including advancing science, including leveraging the federal nutrition programs, including better coordination across agencies, and including advancing business innovation and creating a new incentives for businesses to create healthier food. So I really have appreciated being a part of this discussion, and I look forward to the questions later. Thank you.
Thank you so much, Dariush. That's a really fantastic presentation that links diets to a lot of problems that are along the food systems. So maybe we will move on to the next one. Barbara, are you ready, or shall I pass it to someone else?
Let me try. I might be ready. Let me see if it works now. Okay.
Problem. It works.
Okay, good. All right, thank you very much. Kia ora, tēnā koutou katoa. Greetings from Aotearoa, New Zealand, where we're in the future. It's already Friday here. I'd like to talk about governance at the global level in the context of inclusive diets within planetary boundaries. And the topics that I always like to discuss related to this topic include an understanding of what we think the basic unit of nutrition is, how multi-sectoral and multiple mechanisms are required for dealing with this problem, the problem of sustainable food systems and sustainable diets, make a distinction between healthy diets and sustainable diets, and then include food as a basic human right. The importance of ecosystems and ecosystem services related to diet and human nutrition, biodiversity for food and nutrition, indigenous food systems, and then what I would love to talk about, but won't have time, are issues of food safety, food trade, and food regulations, and the governance associated with those, maybe another time. So first, what is the basic unit of nutrition? For many people, it is the nutrient, but then for others is the food. Food would be the basic unit, and then others would consider diet as that basic divisible unit. The nutrient comes from the health sector model, and that goes back to the earliest days of nutrition science, and where we defined the nutrient, the presence and absence of nutrients related to the presence and absence of diseases. The agriculture sector long has held food as basic unit of nutrition, and this has been promulgated by the FAO, Food and Agriculture Organization of the United Nations, where dietary energy supply, which is basically food available within a country calculated as dietary energy, was the metric for food security and food insecurity. But then diet came along, mainly introduced into the nutrition world by the environment sector, and diet was related to ecosystems and related to food systems, and considered inseparable from human health and planetary health. And when it comes to governance at the global level, the primary body for addressing governance issues related to inclusive diets would be the Committee on World Food Security. And if we think about inclusive meaning including stakeholders and participants, this is a very inclusive body. There currently are 137 member states, and then there are participants from at least 5 different models. We have the UN agencies, the UN itself, and the specialized UN agencies like WHO, along with FAO and the Rome-based agencies, all dealing with food. We have extremely good representation from civil society organizations and NGOs, and these represent some of the most marginalized groups of people when whether we're talking about food systems or nutrition, food security, food insecurity, and they include smallholder family farmers, fisher folk, herders, landless, the urban poor, agriculture and food workers, women, youth, and consumers and indigenous peoples. And then there's the private sector mechanism, academia and research sectors and financial institutions. And as you can imagine, there are tensions and competitions among these groups on governance issues. And some have said that this is a flaw in the design of this, but it isn't. It is a necessity. It's inevitable, and it is required. Private sector, for example, versus NGO, there are many conflicts, and these need to be addressed and aired, and they are in the context of the Committee on World Food Security. The science policy interface associated with the CFS is the high-level panel of experts on food security and nutrition. And this body prepares reports. It's also very inclusive of experts who address that science and research and interpret it as policy recommendations for science to influence and be the basis of policy. And there are many reports out by the high-level panel on many thematic issues. Currently in production right now is a report on equity, and a recent report is on engagement of youth in the food and agriculture sector. So governance at this level is important and functions as well as can be expected for a body that is so inclusive in its membership and participation. The high-level panel of experts has done a lot of reports. They provide recommendations that can be used by the UN agencies, also by national governments, and also right down to the community level. But overarching all of the work in the high-level panel is upholding the central role of the right to food and other human rights in food security and nutrition. And a recent recommendation was for these global bodies to reframe the right to food as freedom from hunger and all forms of malnutrition. I probably not so many people here have been involved in these intergovernmental processes as long as I have, and might not realize that what we simply call the right to food and the document that we refer to has a longer name, and this was necessary in order for the document itself and the articles within the document to be agreed. And it is its long name, Voluntary Guidelines to Support the Progressive Realization of the Right to Adequate Food in the context of national food security. And there were a couple of governments that were not happy with simply having a document on the right to food, but required all the conditions to go with it. And another recent recommendation was that the CFS should formally strengthen these voluntary guidelines by moving from progressive realization to an unconditional realization. And these recommendations are part of the global narrative on food security and nutrition toward 2050. Another recent recommendation from the high-level panel to the CFS and to the world was to add 2 more dimensions to the definition of food security. Most people have defined or realized that that the 4 original elements defining food security are access, availability, utilization, and stability. But it was agreed with a very inclusive process that in order for food security to be properly defined, 2 more elements were necessary: sustainability, especially environmental sustainability related to food systems and nutrition, and agency. Agency being power to the people, and these elements are now part of the definition that is now widely used in the scientific literature and has been useful in moving forward with the whole topic of food security. Recently, just a month ago, the document on critical, emerging, and enduring issues for food security and nutrition was presented to the CFS for decisions related to the next phase of the program of work. And it was prefaced by statements that while there is wide agreement on the need to transform food systems and the elements required to support such transformation, there are often conflicting views on how best to achieve this goal. And there always will be. Sound governance in a robust and a robust research agenda and strong science policy interface and appropriate financial resources are necessary to facilitate this much needed transformation of food systems in a manner that is equitable and sustainable. And the critical, emerging, and enduring issues note was prepared in the context of these emerging crises that are greatly magnified by war in Ukraine and accentuated by the COVID pandemic. But as the special rapporteur on the right to food mentioned in a CFS meeting just a few weeks ago, we could see the war in Ukraine cease. We could have no more global pandemic of any sort, and we would still have a food crisis. And these should not be used to distract from the critical, enduring issues related to food security and nutrition. And this is another key point on this document. Periodically, the high-level panel has published and presented to the CFS critical and emerging issues for food security and nutrition. But the disgrace of governance and the lack of political will in solving the problems of food insecurity and malnutrition are enduring problems. We know what the problems are. We have recommendations on solutions. Many of these solutions have been field tested or have succeeded in some settings. Many haven't. And the role of governance is to assess the reasons why we have some successes, why we have many failures. And the ideal opportunity for that should have been the UN Food Systems Summit, which was held last year, but it wasn't. The critical emerging and enduring issues that were presented to the CFS included 7: building resilient and equitable supply chains for food security and nutrition, strengthening urban and peri-urban food systems in the context of urbanization and rural transformations, the conflicts and fragility of food systems, revitalization, or rather revitalizing climate policies for food security and nutrition, recognizing the role and rights of food system workers, building a meaningful interface for diverse knowledge systems, technologies, and practices, and emerging and re-emerging infectious diseases and other biological hazards that challenge food security and nutrition. And the CFS picked strengthening urban and peri-urban food systems in the context of urbanization and rural transformation. So that is the next issue that will be addressed at the level of global governance. The penultimate topic I want to talk about is the issue of science in science and science-based policies. We have evidence-based mandates everywhere, and not the least of which is in developing policies and governance for food security and nutrition. Now, these evidence-based hierarchies, the most commonly used one, originated in clinical sciences, excuse me, but it is widely applied in places and circumstances where it isn't necessarily suitable, including in agricultural and environmental sciences. And in this strength of evidence or hierarchy of evidence pyramid, traditional knowledge is classified as weak evidence, and it is relegated to the lowest level on the pyramid. In other words, the poorest level of evidence. And for achieving the Sustainable Development Goals and all the goals that we have related to food and nutrition, we need to rethink this hierarchy of evidence. We need to reevaluate it. And this is being done. And taking a leadership role here will hub on Indigenous peoples' food systems. There are, in addition to this paper published in Nature Food about rethinking its hierarchies of evidence for food systems, is the WIFLA paper on Indigenous peoples' food systems. And it has some important statements in there that need to be used for governance when it comes to food systems and let's say, inclusive diets. Time-tested practices and relational values continue to be excluded from science and policy. I've seen this personally in the steering committee for the high-level panel, where the CFS has rejected many of the recommendations because they were not deemed scientific enough. And this included many of the recommendations specifically related to Indigenous peoples' food systems and Indigenous knowledge. Indigenous peoples' traditional knowledge systems need to be recognized, respected, and valued with equal consideration and integration by the scientific and academic communities that inform the summit and beyond the summit. The contribution by itself of systemic observation carried by Indigenous peoples' traditional knowledge is a tested scientific approach. And the strength of Indigenous peoples' knowledge in relation to sustainable food systems lies in its local situatedness, the ability to know and understand local ecosystems, territories, and resources, as well as their functions and capacities. And I wish I had a lot more time to talk about these things, but I think there are a couple of key messages when we're talking about a healthy diet versus a sustainable diet versus an inclusive diet, a definition I haven't seen yet. But in any case, a healthy diet, by definition, is not necessarily a sustainable diet. A sustainable diet, by definition, and we have definitions from FAO, which is a consensus definition, it is a healthy diet by definition. And we are long since past the time when we should be separating environmental health from human health. A sustainable food system does not necessarily produce a sustainable diet, and that was Dariush's presentation was very interesting, looking at the detail and the intricacies of these different systems where we have a model in mind and it isn't it doesn't necessarily produce what we're after. So a sustainable food system doesn't necessarily produce a sustainable diet, whereas by definition, by the FAO definition, a sustainable diet requires a sustainable food system. And I think I'll end it there. Thank you very much.
Thank you so much, Barbara, for walking us through this very complicated problem, but in a very concise way. And thank you so much for accommodating the different time zones. It's really appreciated. And so with that, let's welcome perhaps Anne with your presentation for the next.
Thanks very much, and thank you to the organizers and the fellow speakers and participants. Really pleasure to be here. Can you see my screen? Oh, hopefully not all of that information. Okay. Yes. Thanks very much. So I'm Dr. Annie Trevenen-Jones. I'm the lead of the Global Alliance for Improved Nutrition, or GAINS, Food Systems Governance Program. And today I think the value add that I can bring as an organization is a mixture of the theory, but also the practice of good governance. It's very much for us practice as well as being a research organization. So thank you. So if I think of our program where we operate, is we're very much in this kind of grassroots, local government, urban food systems area. But no one is an island, not even cities. And so we interconnect at national, at provincial level, and at the global level. And I think that's important just to kind of orientate where governance sits. It's not only about this kind of vertical level of governance between the different layers of governance, from local all the way up to, or even grassroots, all the way up to global, but it also includes this kind of horizontal dimension, which is all these different multi-stakeholders from different sectors, from different communities, from different parts of the food system, from production to consumption, all of which have sometimes aligned and sometimes competing interests. We at GAIN like to talk about one GAIN, and increasingly we hear the dialogue of one city and one health. And that really sort of highlights the challenge of governance today, is it's moved very much from traditional models to this multidisciplinary integrated theory and practice. And that certainly is a challenge. It's no longer the preserve of national governments to only provide bread or make sure the population can eat. It's far more complex, and as some of my colleagues have mentioned, including issues of sustainability and agency. I think we've had this figure before, 3.1 billion can't afford a healthy diet. That's kind of the latest figures from the SOPHI report. That's actually 42%. That is a significant amount. And part of it is the multiplier shocks from climate change to the Ukraine, but also to the COVID. That's an increase of 4%. That is huge. But I think it's more significant when you realize it's 3.1 billion people. And so what is the role of governance in providing this kind of food? Especially when we know that 70 to 79% all food produced is destined to be consumed in urban communities. And we see that rise in urban populations, less so in regions like Africa, but increasingly so everywhere. And we do expect the new urbanization to happen very much in the African, sub-Saharan Africa and Southeast Asian areas. So if we have a look at that currently, what that means is 80% in Africa can't afford a healthy diet. Of course, we see figures in Asia, but just to draw your attention to Southern Asia, which is 70% as well. And again, in the Caribbean alone, 52%. So change is happening everywhere. A lot of people can't afford a healthy diet, including 10.9% in upper middle income countries. So it's not always just a global South challenge, it's a challenge for all of us. And it's really an expensive challenge. If we think of and this is the famous 2021 Global Nutrition Report, and I see a lot of my colleagues referencing it, it's because it's one of the few reports that track nutrition. So we see the cost of addressing malnutrition in all its forms is $10.8 billion a year, just to meet the 2030 targets, 4 of the 2030 targets on childhood stunting and wasting, breastfeeding and anemia. But it is also an enormous opportunity for growth and prosperity if we address it. We know from all the speakers that we're just not on track to achieve zero hunger, let alone nutrition. We see through platforms like Nutrition for Growth, which encourage a lot of philanthropic organizations, including the Gates Foundation. It's in excess of 90 million donated this last year, but also governments committing both finances and actions for nutrition. And we see of the 194 countries, only 7 will be on track to achieve 4 out of the 6 maternal, infant, and young child nutrition targets by 2025. And no current countries are able to stop this rise in adult obesity and reduction in salt or sodium intake. I'm not going to spend too much time on that because my colleagues have really deep dived into that for now. So if we can cast our minds back in terms of the global forum, in 2015, when we had those Millennium Development Goal targets coming to fruition, there was great success. We really sort of 50% reduction in poverty. But it was the first goal which combined poverty and food and nutrition together. And I think the lesson here was that we didn't achieve in terms of our hunger and malnutrition numbers under the Millennium Development Goals. And one of the reasons is that we separated that out now under the SDGs, the Sustainable Development Goals, to be explicit. Because if you're not explicit about nutrition, it actually gets swamped with the desire to feed people with calories and address certain immediate or perceived immediate needs, rather than addressing throughout the food system, including genetic diversity of seeds, kind of that nutrition value, as well as addressing that hidden middle of SMEs, from small truck drivers to vendors in informal markets who are responsible for a lot of the access to fresh food and nutrition for those most vulnerable. So just a peg in the ground there. We're looking at dietary diversity, diversity of food, food safety, also making those small businesses resilient, including economically, so that they can continue to provide safe and nutritious foods. Making food affordable, that is the key challenge of our time at the moment. Not only diversity, physical access, local and traditional preferences as well. And being open, I think the COVID pandemic really taught us, don't always preset people who are vulnerable as those on low income. That definitely is where we operate, but we find within there people who are disabled, the elderly. So really being more open to subgroups maybe of vulnerability to nutrition. So if we look at the planetary boundaries concept that came in with Rockstrom and Stefan and colleagues, as early as 2009, they called it the safe operating space for humanities, where that Holocene period where we've been able to actually go from an agrarian society to this industrial modern society, and now in the Anthropocene, where change on a planetary scale is being driven by people, by the actions of people. Even in their 2018 paper, which talks about us moving into a Hotterhouse Earth state, which is not a safe operating space for humanity, they talk about the importance of collective human action, stewardship of the entire food system, new governance arrangements, and transform social values. I mean, these are huge changes that are needed in terms of governance, and the requirement for governance to be beyond a social justice dialogue. If we look at the Human Development Report, it's been operating for 32 years when they've looked at human development indices around a nation's health, education, and standard of living, and its ability to pursue prosperity. And we see for the first time in 2 successive years, this has declined across almost all countries, at least for 1 year, if not 2 years. That is huge. But at the same time, the report talks about a sense of opportunity, and all countries are developing in this sense, charting a new planetary course together. So bringing that nutrition dialogue into the environment, into food, into societal transformations amongst all of this uncertainty. And that's really important to still see there is potential for change, but it does require at very heart societal change in our values. So worldwide, less than 12% of national policies actually do consider climate, biodiversity, and nutrition explicitly. And only 32% of national action plans include adaptation actions related to food safety and nutrition. So really getting to the heart of this, a lot of governments have moved towards a food rights basic principle, but food safety and nutrition kind of being hidden in that narrative. So increasingly, there are kind of 4 dimensions that are seen to achieving sustainable and healthy diets, making a sufficient nutrient-rich and staple foods available. And how do we do that? That's an inclusive way that brings on those small and family farmers, and sort of a disconnection from the industrialized global food system, which is broken, empowering consumers to make informed decisions, and also increasing demand for the good foods and less demand for the bad foods. And that's easier said than done. Consumers are not always looking at recommended daily allowances when they're making choices. And ensuring foods move along what is becoming increasingly long food value chains because of urbanization, shifting out peri-urban areas, and the costs involved, and these kind of hidden middle of small, medium businesses that operate largely informally in many countries in the global south, and ensuring affordability of those nutritious foods, but less affordability of ultra-processed foods or those high in salts and sugars. So how do we achieve this? We know that the challenge is huge. We know we have these multiplier impacts of increasing scale. And within the dialogue of good governance for food systems and nutrition. So we have this debate between rights and obligations in some of the disciplines. An example would be, for example, Brazil, when they brought in their FOMO Zero Hunger initiative, which worked at all scales of government, included research institutes as well as finance institutes, as well as education, as well as social safety nets. That was back then under the former, although possibly new, President Lula da Silva. We see it in South Africa within its very diverse constitutional Bill of Rights. But when you have so many rights, there's also who's obligated to do what that comes through it. That is the question. And a lot of governments will argue that their job is to create a space for people to pursue their prosperity, to be agents of their own change in nutrition. The extent to which multi-stakeholders, sectors, and government tiers are involved is sadly lacking. And it also depends on the kind of government that is, or the governance model that is in different countries. So we really need this radical shift in mindsets that is also attentive to trade-offs. So everybody talks about win-win. If we increase nutrition, we'll also increase financial opportunity, we'll also increase well-being and health. But invariably, public policy is a tricky thing. You move one lever, and sometimes you get a lot of negative or unanticipated results. So that is the importance, of course, of monitoring and evaluation and really tracking those indices on nutrition. And we've spoken about freedom as development, and that's really goes back to Amartya Sen and his idea that if we need to remove barriers, and those barriers are different for different people. That's very much about inclusivity, but also equitability and the notion of food justice. So what are these barriers? If we look at school meals, when people miss a school meal, they start missing school. They start being able to less cognitively understand the work that they've been taught and less able to, and actually their mental health comes under stress. So suddenly their ability to become prosperous, to be be effective agents of change is reduced. So, inclusivity really getting to the heart of that. So just important that we find that there's this difference between government and governance. And particularly in our fieldwork, we find that it's important to stress that government is not always governance. So government being very much depending on your government model in your country and, of course, your context, your local context, whether that's environmental, social, economic, cultural. It's a mixture of elected and appointed officials, which means you've got people that are there for an electoral term or 4 years, for example, as well as officials who are employed in departments and are working and have their own structures and definitions. And between the two, it's the delivery of policy. But whether it's at national level or at all these other levels below national, going right down to local municipalities and city municipalities, there's a bit of a dysfunction there in actually getting that coherence and coordination on board, as well as the data, lack of food systems data, but also fragmentation and a lack of sharing and users being able to use it. And important to know that elected officials come from many different backgrounds. So understanding the complexity of the food system is also a challenge. Whereas governance is much more about process and structures, about tools that you can use, about the public budget, about implementation, about capacity and resources, about multi-stakeholder engagement and ownership of policies. And yeah, I've mentioned that already. Sometimes governance doesn't have to be formal. It can happen in informal markets, fresh food markets, where there are these informal committees, whether they're recognized or not. Or in Canada, for example, they also have food policy committees that advise the local government. And important to note that informal, I don't just mean informal markets, because many of these informal markets also intersect the formal sector. So just trying to really open up that discourse beyond the big businesses of nutrition and food systems. So just moving along, what does good governance mean? In fact, it's a growing list. It's about effective, efficient, and quality governance. So performance, being accountable and transparent. It's about elections, respect for the rule of law. Is it participatory and responsive? And then bringing in these later ideas of sustainability, longevity. Is it a policy that lasts for long in terms of its future outlook, and reaching many people in terms of inclusivity? And that goes to the fact that, of course, before policy has a long cycle to go from concept to actually design and implementation. The capacity to change, that is very much of the Anthropocene. Is it ethical, and does it encourage the right of individuals' agency? So not just about leadership and not just about knowledge, although these are very important, as we saw the competing kind of scientific knowledge, practice, and also traditional knowledge. So we need to move governance out of its traditional mode, because with the changes that we have now on a planetary scale, more people are being left behind. It's so much more difficult to actually achieve our goals, and more people are being left out. I'm not going to go into all of this, but to sort of say, traditionally, people have thought about nutrition belonging, or food, in the Department of Trade, Health, Agriculture. And informal fresh food markets are about getting fees for local government. And so we need to really break these molds as well in government, which is pretty fundamental but wide-ranging. And this is kind of one of the drivers. So increasingly we have this urban population, but it's not just huge big cities, it's small towns, villages, as well as this rural connectivity. Cities do not exist in a vacuum, they exist in a food system, and understanding how all of these communities connect is really important, and hence the new urban agenda, which we look at. I think I've mentioned this. I think one of the most important points is how we get from policy to plans, and they operate at different scales. So some of them are like 10-year plans, some of them are 5-year plans. The budget, really, the public budget, which a large amount is funded by taxpayers' money, that really operates at sort of national level and the level just below that, which is sometimes called province. but actually at your local government, which is connected to the daily implementation and daily relationships with citizens, they have to get a lot of their money from rates and taxes and fees of vendors. And so they lack capacity, they also lack resources, and particularly the budget. So these are things to consider, these timelines when national governments are making big commitments at COP27, the climate, for example. How is that going to actually be realized by an urban government and an informal fresh food market in that city? I think that's kind of how we bring it down. Just to mention that these informal markets, sometimes called wet markets or open air markets, but also including street vendors, really connect with 70% of urban households in poor urban African communities. They're a huge part of the economy as well, but they often fall outside of policy and investment. They're regarded as risky and a bit of a nuisance and not to be invested in. And yet, imagine the impact we could get if we focused on food safety, quality, encouraging diversity within the vendor sales. That has a knock-on effect on production, but of course it does require both small farmers and vendors to connect so that there's not an oversupply of food that they're not going to sell. Is there year-round green vegetables available that is climate resilient, immediately highlighting the value of old traditional and gathered crops, for example. So GAIN also works on policies that are not on a macro scale. We look at the micro scale, and during the COVID, we worked in kind of 6 cities in different parts of Africa and Asia, co-designing with them on the basis of the quick, rapid assessments that we did and the evidence, how they could actually govern their markets. So a relationship between local governments and their formal or informal market committees. And it's amazing what people can do just with their own resources and knowledge and time. But even so, when you have a low income, time is a luxury. So I've spoken about the trade-offs. People often talk about, well, bring in technology. Digital is a huge thing, but digital can also leave people out. For example, cashless transactions, M-Pesa, for example, in Africa, which is a mobile phone service where you're able to transact, is supposed to help people. We know, I read something in the COP27, something like 70% of women who are farmers to vendors actually borrow small loans online at 3 a.m. in the morning, and by 7 p.m. in the evening, they've paid back these small loans. So there's huge amounts of potential within that, but it's kind of outside of public governance, certainly. So it's important when people get into debt with their service provider on their mobile phone, who's also their finance provider, how do we manage this? These are all new challenges as we push the frontiers. So Jess also mentioned the food systems dashboard. Okay, so food systems dashboard, but also to mention we're developing a subnational dashboard because that is about more specifics, details. Cities need to make more specific information at a subnational level. There's a lot of policies that are coming in, including social protection. Cities are sharing information more now about the practices, what worked and what didn't work, and that's really important. They have networks, city networks, which are always useful and really help people and communities and governments move along at a local level, but also with global mentioning. We talked about the CFS earlier on, just to mention that the urban agenda has been really put on the map globally through the Urban Food Systems Coalition. Anybody interested, please look it up. And that is about connecting those levels of national with subnational levels of government, as well as multi-stakeholders, and about evidence as well. A lot also going on at COP27, linking agriculture, health, and nutrition. So in a nutshell, thank you very much for your time. Thanks.
Thank you so much, Anne, for this brilliant talk, walking us through a lot of different and very challenging topics. And because the time is running out, let's move on to the next. Hannah, the floor is yours.
Good morning.
Good morning.
Share my screen here. Let's see. Does that work? Can you see it?
Yep.
Great. Well, thanks for the invitation and thanks for this great discussion. I had a chance to attend yesterday as well and really enjoyed learning about the different kinds of work that people are doing on inclusive diets. I'm a rural sociologist and I work in an interdisciplinary unit at UBC at the Center for Sustainable Food Systems. We actually work on the traditional unceded and ancestral territory of the Musqueam, Squamish, and Tsleil-Waututh Nations, where I'm calling in from today on the west coast of North America. My work is with agrarian and indigenous social movements on the principles and practices of food sovereignty. We also work on agricultural transitions, and I'd like to kind of talk about the work that we're doing to connect the principles of food sovereignty, inclusive diets, and agroecology in several different projects. By transition, I mean taking a really hard look at the diverse global and local contexts and mechanisms, those that involve both structure and agency, that in different combinations shape food system outcomes for both people and planet. And really looking at what are the critical levers for change if we're thinking about inclusive diets. So food sovereignty is a concept that's integral to good food governance. It offers a framework to look at the system as a whole, local, national, international elements, and also acknowledges synergies and contradictions between those food systems, elements, and actors. And in her presentation just now, it showed us a whole array of different food system components, governance components. What are the interrelationships between those components? And how do we work through that to have a clear framework for policy design and governance that links grassroots actors with the state? So, pardon me, it's early here still. What is an inclusive diet from a food sovereignty perspective? It's culturally appropriate. We want to increase dietary diversity and cultural and address cultural preferences. We want to increase the supply of and access to less processed food and more fruit and vegetables instead of continuing to subsidize corn and soy, kind of along the lines of what Dariush was encouraging. We need an inclusive diet that's ecologically sustainable, inclusive of people and nature. We need an inclusive diet that's empowered, that actually engages people in the design and governance of their own food systems. And then we need an inclusive diet that's equitable, that considers the needs of both farmers. We haven't talked very much about farmers today, but I'm going to talk about them, and consumers. So we want to reduce that trade-off between ecological sustainability, food price affordability, and farmer livelihoods. So it's about responsibility. So who is responsible for inclusive diets? Is it governments? Is it industry? Is it researchers, farmers, consumers? What kind of food should be reproduced? Is it organic certified? Is it fair trade? How do we decide what is healthy food? Is responsible soy necessary for an inclusive diet if we're wanting to reduce the amount of processed food? Who is supposed to produce this food? Small farmers or large farmers? Local farmers or farmers from far away? And then finally, the area that I work a lot in, we ask on whose land should these diets be produced? Public land, indigenous land, private land, land consolidated by the financial sector as an investment. So the governance of an inclusive diet is really involves these social and political questions. These are not technical questions, but they're important political questions that have implications for food security, environmental management, and social and economic inclusion. So my talk today kind of aims to get us started thinking about some of these questions, and I will offer a couple of illustrations from some of my research in Brazil and in Canada. So yesterday we had Matti Kumu on our panel, we were fortunate to hear his work. This article has been very influential about talking about the safe operating space for agriculture in the face of climate change. Given the clear impacts of industrialized agricultural systems on the environment, not just in terms of climate change and biodiversity loss, but also water contamination, toxic exposures, loss of habitat. Some conservation organizations have suggested setting land aside for nature, meaning there could be even less land available for food production. So this kind of ongoing ontological separation of people and nature continues to see conservation as without people, without farmers. And frameworks like land sparing suggest that intensifying production for a narrow range of commodity crops will somehow feed the world. But these proposals somehow elide the fact that much of the land the working landscapes of the globe that are actually producing inclusive diets, that are producing biodiversity as part of a working food shed. These are lands that have been sustainably stewarded by Indigenous peoples for millennia as their food lands. So we need to be careful about when we're talking about inclusive diets, if conservation target areas are occupied by small-scale farmers who have been consistently pushed onto marginal lands as large-scale agriculture expands in their territories, we need to think about the governance arrangements of land as we think about who could possibly produce a more inclusive diet. So to kind of bridge this people, nature, producer consumer barrier, a lot of the work that I do these days falls within the world of agroecology, which is increasingly characterized as a science, a practice, and a social movement. So as a science, agroecological scholars draw on rural and environmental sociology and agronomy, gender studies, political science, ecology, and many other disciplines to understand agriculture and food systems as socio-ecological living entities that actually serve to bridge people and nature rather than keep them separate. So as a set of practices, agroecology involves production-related activities based on the idea of a socio-ecological metabolism, a circular economy, recycling nutrients and relationships between society and nature. And agroecological approaches to food production also recognize the importance of what we call polycentric governance systems, making really clear linkages between these different scales of decision-making and between different nodes of the food system. So consumers are an integral part of agroecological production planning. We look at dietary diversity and agrobiodiversity as two sides of the same coin. And then finally, as a social movement, agroecology has been associated with food sovereignty as a way to rethink the way we feed the world in harmony with, instead of trying to control, nature's processes. Yet the science, practices, and social movement potential of agroecology and food sovereignty are all contested. On the one hand, many researchers suggest that agroecological transitions are necessary to feed the world equitably, while also mitigating and adapting to climate change. But on the other hand, there's resistance to this. So bottom line, we know that inclusive diets depend on protecting biocultural diversity, and that the best way to protect biodiversity in working landscapes is to support smaller scale and diversified farming systems. So research in our group has shown that small farms globally continue to support higher yields and more biodiversity, not just wild biodiversity, but also agrobiodiversity, and then, the corollary dietary diversity. We know that family farms, rather than corporate agriculture, tend to produce a more diversified agriculture. There's lots of caveats to this. Many family farms, particularly in North America and Canada, produce corn and soy. But if we look at the global sector and we look at the small farm sector, this is where the most of our fruits and our vegetables come from. A lot of the foods that we do want to be producing more of. The challenge is that ongoing trends of land consolidation threaten the capacity of these globally diverse farmers to meet nutrition, climate adaptation, mitigation, and biodiversity conservation goals. So we're moving in the wrong direction. As we get more land consolidation, we get more mechanization, we get more homogenization, we increase our production of corn and soy, partially to kind of feed the growing demand for factory farming meat. And so how do you transform those lands back into these more diversified systems? So last year I led, I guess, two years ago, I led the project team for the HLPE report on youth engagement and employment in agriculture and food systems. And we found that access to material resources, and in particular land, rather than technology or knowledge, was seen as the biggest barrier to generational renewal in farming populations across the globe. So young people want to farm sustainably, they want to engage in diversified food systems, they want to produce for local markets. Land access and competing with kind of the financialization of farmland is one of their biggest challenges. So land governance is a pillar of global policy commitments, from conservation to land reform to ensuring tenure rights for women to ensuring mechanisms for intergenerational succession. We see that land governance is fundamental to the achievement of many of our other sustainable development goals. And so really taking a close look about producing an inclusive diet from the ground up is a really key point. So in a recent paper, we explored the concept of land governance for agroecology, which I've kind of posed here as a basis for discussion on, land governance for inclusive diets. So land governance is concerned with who is able to make decisions about what happens on the land and how responsibilities to the land and for the land are distributed. So land governance regimes are comprised not only of the actors and rules that structure land-based activities, but they're also comprised of ideas about land itself. What is land? What do people think that land is? This requires an understanding of the really distinct, we call them ontological foundations that underlie the basis of land governance. We consider, how is land considered as a relation? So many indigenous communities and land-based communities see land as a living being that's in relationship with them. It's a more mutualistic relationship. Versus Western agriculture kind of very much sees land as a fungible property, as a investment in a commodity system or a capital growth system. It's a piece of input rather than a relation. So reframing what we think land is kind of can help us rethink about what land is for and who should be involved in making decisions about it. That then helps us think about the effectiveness of existing institutional contexts that govern and regulate what happened on the land. So in this paper, we explored the history of agricultural colonization in Canada and Brazil, so two places I've done a lot of work over the years. And these are examples of advertisements circulated in Europe in the 19th century to attract settlers to what was very clearly portrayed as empty land and virgin soil. So there was a formal governance system of land claims and agricultural regulation that violently erased a landscape that had been providing a very healthy and diverse diet for generations. And instead it replaced it with a system that not only does not feed people an inclusive diet, but it's also not resilient to climate change. So this is a photo from a news story this year about how 40% of Western Canada's wheat crop last summer was lost due to extreme climate events. My sister is a wheat farmer, and so this really felt close to home for me. My family also migrated to North America to produce landscapes that look pretty much like this. A very similar process occurred in Brazil. These examples of settler colonialism are not unique. I'm not picking on Brazil or Canada. On the left is an immigration magazine from 1908 in Brazil. Brazil abolished slavery in 1888, so the enslavement and forced migration of over 5 million Africans is not recognized in this image. The Japanese poster states, "Let's go to South America with the family." So in Brazil and in Canada and elsewhere, this process isn't over. This isn't a historical process. Land grabbing via financial investment in farmland, and what Melissa Leach has called green grabbing in terms of conservation set-asides, are very much a contemporary concern. So land governance and land policy are key to reframing the food systems of the future. So in British Columbia, where I live, the Agricultural Land Reserve has slowed farmland consolidation and made it somewhat possible for family farming to continue. This occurs in tension with Indigenous communities on whose unceded territory this agricultural land reserve has been placed. So again, this is a Western zoning institution that has designated certain lands as appropriate for agriculture without thinking about the other kinds of Indigenous food systems that may or may not be compatible with agriculture. In Brazil, the recently and thankfully deposed Bolsonaro government tried to reduce the size of many Indigenous territorial demarcations, as well as those lands allocated to land reform and Quilombo settlements. So these lands are still threatened by the expansion of cattle ranching and soybean production for global markets. But there are alternatives. So we work with agroecological certification networks in a number of countries that are bringing urban people to the table to engage in land protection struggles. And these urban people are also really working hard to support diversified farming through agroecological certification and organic markets. So here's an example of a diversified farm in southern Brazil where my PhD students have been doing some field work. This farm is restoring Atlantic forest. It's producing a wide variety of foods for local markets, and the farmers are earning a sustainable livelihood through price premiums for agroecological certification. So I'll close there, but I'm happy to talk through the bigger elements of land governance that are needed to protect our capacity for sustainable and inclusive diets. So I really think we need to start with the soil.
Thank you so much, Hannah. That's a really impressive presentation. And we can put our foot on land. Now we know more about the land governance and sustainable farming practices. So thank you all for your presentation. And I think we can now move on to this very exciting panel discussion session. I might pitch questions to some specific speakers, but you are all very welcome to add on as you see fit. So maybe I will start with governance in general and inspired from your presentation, Barbara. I think you've mentioned that recent years we have seen greater acknowledgement that dietary guidance must consider both nutritional needs and sustainability, inclusivity, human rights, a lot of things. And many guidelines have been revised, particularly following the Eat Lancet Commission back in 2019. And now we see, as Dariush let us know, this very exciting Biden administration decision, new approach to improve health, nutrition, and also sustainability. So from your perspective, Barbara, to what extent are guidelines now accounting for sustainability and especially inclusivity, human rights? Are we getting closer to this multifaceted need?
Good question. I don't have a good answer for that, except to say that it varies across countries and population groups. And we see this, of course, in the commitments and honoring commitments in the context of climate change. I think that it's a crisis point and the tipping point, and we have to make hard decisions. But then again, think back to the 1970s with the Club of Rome and the population type of assessments that came out related to climate, related to food, and the limits to growth. That was described at the time as the most important and powerful book of maybe the decade, maybe the century. And it should have been, but it wasn't. And we have exceeded so many of those limits to growth and those planetary boundaries. We've changed our vocabulary. We have evolved. We've pinpointed the limits, what those limits are, what the cutoff points are for exceeding them, but we are still failing to achieve what we know we need to achieve. And I think when I see it at the global governance level, when I even see it at the national levels, the problems are vested interests and greed, and I don't see solutions coming from scientists to solve those problems. I think we need another great disruptor, and I don't know what that is.
Thank you so much, Barbara. Yeah, exactly as I said, I echo very much, like different context, different culture, different socioeconomic conditions just make the already complex problem even more complex and complicated, and also political wills and just a lot of barriers that kind of still preventing us from realizing what we should do. So perhaps perhaps when we are trying to improve the better food governance, we need also to find the red thread that where we need to start as the concrete first step. And I guess maybe I will address the next question to Dariush, more about nutrition. So Dariush, in your recent Nature Food article, I think you have mentioned also in your presentation, you find that diet quality has improved, but very modestly between 1998 to 2018. It is due to poor guidance, a lack of individual capacity to adopt those sounding guidance, or some personal choice conflicting with the guidance, or the three of them, or even more factors beyond these factors?
Well, first, when we found that dietary quality, overall dietary quality in the world only gradually improved, slightly improved in the world, but we also found disparities. And so we found in the poorest parts of the world, Sub-Saharan Africa and South Asia in particular, diet quality didn't improve at all. And so in some parts of the world, it didn't improve over 20 years. And related to what I discussed in my presentation, there's conflicting reasons for why diet quality is or is not improving. And so, for example, in middle income countries, there is actually, we identified increasing intake of healthful foods. And so that was good. And so we'd expect that to improve diet quality. But at the same time, we identified increasing consumption of unhealthful foods, which was offsetting that. In the poorest parts of the world, there was no increases in healthful foods and substantial increases in unhealthy items, particularly, highly processed industrialized foods. And so there are differences around the world in what's happening, and so that highlights different issues. I think one thing that's clear to me is that a focus on education and knowledge is not going to move the needle, because we have a broken economic system. This is if you take an official economics definition, our food system is broken because it is not supplying what the consumer thinks they are getting. It is harming the consumer. It is harming our economic system. And to get to Barbara's point, I do think actually science will move the needle, because I think science can show these burdens for healthcare costs, for economic productivity. And so to get back to Barbara's comment, I agree with her. Dollars are ultimately what's going to move the needle. Showing that fixing the food system is going to reduce healthcare spending, increase economic productivity, make nations safer, improve their national security. That's what's going to work. It's not going to work to have a moral argument and an ethical argument and to have a discussion of disparities. Unfortunately, it's not going to work. So I think that we need to move away from behavior and knowledge and education and identify that we have a broken system. If we had mobile phones around the world identified to be killing millions of people, we would get those phones off the market. If we had toys that were identified very likely to be killing children if they bought them, those wouldn't be sold anymore. And yet somehow we have the majority of foods in the food system are harmful, and a minimum are not harmful. Now, I'm not saying we need to have just pure regulation and banning foods, but we need to have systems change, and those systems changes need to provide economic incentives from government to make healthier foods, and then economic disincentives from government to sell unhealthy foods. And we need to integrate that into the private healthcare system, public healthcare system. We need to advance science. So I think it's a long answer, but I think I'll also just say that the current food system was not created nefariously. It was created as a very conscious creation to deal with two tremendous problems of the 20th century, which were vitamin deficiencies and lack of adequate calories for the population explosion. The human population, more humans were born in the last century than in all of human history combined previously. So our food system was created roughly between 1930 and 1980, the Green Revolution and fortification and the era of vitamins was all done very consciously to solve those two problems of the 20th century. And we solved those two problems of the 20th century largely. There are some residual issues. And so we have relatively recently identified these new problems: sustainability, lack of sovereignty, health disparities, sustainability. We can fix it again. We can fix it again, just like we did in the last century, but it's going to take political will and public recognition.
Thanks a lot, Dariush. You made a really good point of this top-down approach. And just follow up, we see in many of the presentations that all of you may touch upon about the business role, like the role of food industry and their advertisement of unhealthy, unsustainable food. So is there a stronger governance or regulation needed to push them go to the right direction?
Is that a question for me? Yeah. I think the food sector makes the food, so they're not the enemy, right? They have to be co-opted and with carrots and sticks, right? Farmers make the food, shippers and producers and cold chain storage get the food to restaurants and retailers and farmers markets, and small shareholder farmers, of course, are making foods for their own families and for their local neighborhoods. So the food sector is not the enemy. The food sector is humans trying to make food for the planet, and we have to give them appropriate scientific guidance. So for decades, we told them to make low-fat products. For the last century, we told them to monocrop the world, to create rows of wheat and rice and soy, because the world was going to starve, and probably 1 billion people would have starved if we didn't do that. So the industry has mostly followed and done what we've told them to do. The problem is now we have legacy major players who have this legacy system that isn't working anymore, and they have a big financial incentive to keep the system the same. So I think absolutely we need to work with the food industry, but changing their marketing isn't going to make a difference. We have to change consumer demand, and we have to change the financial incentives for making healthier food. Many companies make healthier versions of their products. Many restaurants make healthier versions of their products. They don't sell. So they don't sell. So it's more of a challenge than just blaming food industry for marketing.
Thanks a lot, Dariush. That reminds me of very kind of points, timely points that link to Anne's presentation, who mentioned about food markets, especially in the global south. And we know that that market could play an important role to offer affordable and nutrition food. But because of the onset of the pandemic, we also see there are a lot of criticisms and huge debates on the role of that market. So one issue with these markets and informal sectors as a whole and is the lack of data, maybe. So is this a concern of forcing assumptions regarding sustainability of the vet market in the global south a big problem, a big challenging?
Is that a question for me? Thanks, Zhang. So there has been an impression about the informal markets, partly buoyed by evidence, that they have unsafe food. So the zoonotic diseases that we saw with the wet markets in Asia, for example, but also in Africa with eating wild meat and foods has been a concern, and putting fresh fruits and vegetables together. But it's also been seen as one of those small, very high-risk businesses to be involved with. The development banks, which are a huge investor that are part of the solution, are reluctant to invest in the infrastructure surrounding informal markets because they're not seen as having that political backup as well. And usually you want to have a partner with national government as well as local. And so they kind of have seen as a bad name. They're seen as a nuisance. They're seen, ironically, as high food waste. But in the global south, because many of the low-income consumers will almost eat food at any value, at any quality, at any dietary value, there is actually very little waste. And they are already doing their own kind of circular economy in feeding waste to animals already. So it's a very different setup to other places, but a really core one, because many of these markets have their own informal governance structures with some investment and kind of trust in systems. There could be an enormous boost to low-income consumers and those consumers that need to be able to access food because they're in a city. Those markets are where they're going to get most of their food from, not sufficiently from urban agriculture. So yes, I think there's an enormous amount of potential there, but it's a case of improving food safety and quality. Cool rooms are seen as a climate adaptation mechanism, but again, the investment is needed not only to invest in the infrastructure, renewable infrastructure powered by renewable energy sources, for example, but also who maintains it, who is responsible for it, what is the relationship between ownership of that and management. And so I think multi-stakeholders, including vendors, can play a key role in that. Thanks.
Thank you so much, Anne. And I think you mentioned a really important role of the producers, like the farmers in the from the production side. So that relates, I think, quite align quite well with Hannah's talk about the land governance, the sustainable agriculture practices. And Hannah, as you mentioned that given the significant overlap between food production and biodiversity conservation, do you feel that food production is sufficiently considered in the negotiations around the post-2020 global biodiversity framework, especially the final phase that will take place soon at a COP15 next month?
Yeah, I think it's a very, very active conversation. So agriculture, the kind of industrial agriculture model that the Green Revolution put in, you know, to produce those calories at high volume, that was done by clearing biodiversity, both cultural practices, as well as, you know, agrobiodiversity, as well as kind of natural edges. Field sizes got larger, farms got larger, and there was a whole set of subsidies that were put in place to make that happen. So that kind of homogenization of the landscape wasn't intentional, as Dariush said. It was done quite thoughtfully with, you know, cheap fossil fuel inputs, the kind of permission to evict traditional landholders from their territory. And so that was a very intentional process of making it so that agriculture and biodiversity were not compatible. What the agroecological approach says is that you can have land, what we call land sharing or wildlife friendly farming, where we re-diversify the landscape. And by diversify, you mean there's, you know, diversifying crop production. So any one farm or any one region is growing multiple crops over periods of time. So that's healthy for the soil. So thinking of microbiodiversity, that's healthy for the ecosystem in terms of getting nutrient recycling going. But then you can also, with a smaller farm-based landscape, you get more edges, you get more natural areas. Brazil, for example, has agricultural zoning where every farm has to have a natural area reserve. And so if you think about landscape recomposition, you can actually, on these more heterogeneous agricultural landscapes, get higher food production in terms of calories. You can get more diverse food production in terms of micronutrient availability. You can start producing the plate that the Eat Lancet report has asked for, which is fruits and vegetables, you know, making those foods available to people. You know, in the previous question, it's like, you know, is it personal choice or guidance why people are not eating correctly? Well, sometimes it's because the food isn't available, right? It's not being produced locally, or it's not being produced at a price that people can afford. So increasing that supply of the healthy foods is really part of producing biodiversity friendly farming, and sort of taking seriously this idea that we have to work together to conserve nature. We've shown for many, many years that simply taking land away from people and putting a park boundary around it doesn't necessarily conserve that landscape. So I think just rethinking about land rights and stewardship and what kind of agricultural system can be win-win for biodiversity and nutrition is, I think, a really key topic that is being discussed and in kind of the lead up to the CBD.
Thank you so much, Hannah, for giving us this very enraged and very timely answer about how the food system is now incorporated and consolidated in the GBD and all these discussions. And you mentioned several very interesting and important points, which I think lead us very well to the closing kind of question to all, which is that, as you mentioned, the accessibility and affordability and availability of sustainable food and nutrition food, that's very important. And we are now all living in a time of compounding crisis, instability, and increased vulnerability to system shocks, be it a pandemic, the Russians' invasion of Ukraine, and we're living on a warming planet. So what, in your opinions, each of you, are the key governance levers to help enhance food system resilience in light of such shocks to enable us get a better food governance frameworks? Maybe Hannah or someone would like to start first. Barbara?
There are a couple of terms I think that indicate we've surrendered to some inevitability about failures. And one of the terms I'm not really fond of is adaptation to climate change. And I prefer our restoration. We're in the decade, the UN has declared this the decade of ecosystem restoration. I think ecosystems need to be restored, and I think we need to think of our food supply, our food system as our ecosystem, and we are part of that. And one of the original concepts of sustainable diets was an ecosystem approach to eating, and I think that brings in issues of food sovereignty, and it brings in the issues related to agency, people making decisions themselves as far as is possible in existing circumstances to ensure their own food security and nutrition. And that can be something as simple as providing for some of their own micronutrient requirements. If you have land, if you have a little bit of land, you can have 4 trees in a kind of permaculture situation and provide for your vitamin C requirement year-round from those 4 trees. There are a lot of small things that people can do. You can, take it from the global level all the way down to the individual household level, or you can start at the household level and then hope that you can work within that, within those governing systems to achieve your food security. But I think there are, I think if you consider your ecosystem, and the analogy I like to use is a mother and a baby. That is the perfect ecosystem. The breastfeed, the lactating woman, the breastfeeding baby, and if you think about what that means, and you think about the governance issues around breastfeeding, you've got probably the most powerful code of conduct that in the nutrition world anyway, which is the code of conduct for the marketing of breast milk substitutes. That has worked, and I think if we can align some of the articles or the preface even to that original document for the code of conduct for marketing of breast milk substitutes, and replace the word mother or woman with ecosystem, and then use that to promote kind of a concept of local eating and local empowerment, and a system that is perfectly sustainable in many ways. I think we can help do that. And the upcoming International Union of Nutritional Sciences conference is taking place in Japan next month. There'll be sessions on developing a code of conduct for sustainable diets that can involve individuals all the way up to the UN system, just like the code of conduct for the marketing of breast milk substitutes has done.
That's lovely. Thanks, Barbara, and thanks for this very nice analogy. Anne, would you like to follow up?
Yeah. Go ahead, Anne.
Too many Hannahs and Anns. So just, I think, building on Barbara, of course, it is that connection, living in the world that we are now, accepting that, and accepting that nation states are not the only ones who can have a voice in these global places, but at the same time, encouraging that reconnection with who we are and our food systems. So there used to be that lovely thing about flight maps where people ate pigeon pie when it was time for the pigeons to come, and ate vegetables, and those connections between who we are, how we live, and our environment are often lost through the supermarket freezers. But where you do have, whether it's organic fruit, fresh food markets in the Northern Hemisphere or informal markets in Africa and Asia, is you have that reconnection, that connection through your vendor. Where did this food come from? When is it coming next? Oh, I'll do that. Oh, this, which you don't have in our industrialized system. So maybe about reconnecting, but also having a governance space where you're not just waiting for something to happen. You go out and connect formally or informally with others to create that sustained change. Thank you.
Thanks a lot, Anne. And Hannah. Cross.
Yeah, so, one of the things I think about is policy is often looking for what we call the silver bullet solution. They want the one lever. And oftentimes when we think about solutions, solutions to vitamins is biofortification, or solutions to hunger is calories. If we think about it as in that kind of narrow context, we often create more problems than we started. So really, I think that the lever has to be something like holistic thinking. It has to be systems thinking about food systems. And when proposing any one particular policy intervention, we actually have to do the work of thinking through those theories of change and how they affect other elements of the system. And an example of a policy framework that did that really well was Brazil's zero hunger framework. Starting in bringing forward some legacies from the 90s of conditional cash transfers and poverty reduction, but then coupling that really intentionally with sustainable agricultural promotion, land rights for women, land rights for youth, land redistribution, agricultural and ecological zoning. So having, public procurement programs that incentivized farming system diversification and paid price premiums for, reduced use of pesticides. So each one of those levers was tightly and thoughtfully connected to another element of the food system. So reducing poverty allowed urban people to, buy local food in the market. Public procurement programs guaranteed prices to farmers to maybe take that risk to transition to an agroecological system. And so you could see over that period of time, a lot of really positive outcomes for nutrition, for ecology. Some of that was dismantled the last 4 or 5 years, but it wasn't totally lost. And so we think about the final piece of that is who's paying for all this. In the 2000s, what was paying for all that, unfortunately, was economic surplus from the export of unhealthy products like soybean from Brazil. And so we think about, okay, what's going to fund the agroecological revolution? Is it surplus from the green revolution, or are there other ways to fund that? And I think that's where we really have to think about governments and who's responsible for paying for this. The governments did pay for the green revolution. We subsidized fossil fuels, we put in infrastructure, we put in ports, we put in trains and roads, and we put in a lot of infrastructure to enable commodity agriculture to excel. So I think about what kinds of infrastructure are needed to allow a food system oriented towards this inclusive and sustainable diets to excel. Dr. Ann talked about the wet market upgrades. That's a really good example of where governments could invest in improving access to sustainable, diverse urban markets for fruits and vegetables. That would be a nice place to put tax dollars, right? Instead of an export deep water port like what they're doing in Vancouver. So I think, the bottom line is looking at those holistic interventions that benefit both people and nature, and then really figuring out who's going to pay for that, and looking at the cost benefit of these kinds of investments versus investments oriented towards continuing the status quo.
Thank you so much, Hannah. And thank you all for your closing addresses. I really love to continue this conversation because it's so interesting, and we see this complex system of food governance frameworks definitely need different levels and different efforts from various stakeholders. But we're running out of time, and I really appreciate all your time joining us today, especially Barbara from a quite time jet lag place. And I think, unfortunately, Dr. Dariush Mozaffarian has to left us because he has another time conflict. But thank you all for your time, and I enjoyed this panel discussion a lot, and I hope you all enjoy the presentation and discussion. And thank you for your participation, and hope take care. Hope to see you in the near future. Thanks. Bye.
Bye-bye.
Thanks
Thank you.
very much. Bye.
Thanks.
Bye.